All right, well, welcome to our version or today's Ask the Experts virtual town hall. Today we're here to talk about the OC survey and public perceptions of the pandemic. I hope you all are well and healthy. My name is Tom Pietta. I'm the Vice President for Research here at Chapman University. I'll be moderating today's town hall. This is certainly a timely discussion. As you all know, conditions are improving in our community. Vaccines are being widely available now, and expansion into other age groups such as 12 and 15-year-olds, which I hope we're hearing about final approval on that today. Orange County is the rate of vaccination is getting very high, and you'll hear from some of our experts today. I think I saw the number at 50% as of our population receiving one dose right now. So it's certainly a topic that we're all talking about at home, talking about with our colleagues and our friends, and I think lots of people it leads to a lot of interesting discussions. So what we're going to do today is talk about some of the survey results that a couple of our faculty have gathered from an annual survey that they do that looks at the community perceptions of the pandemic. And we want to be able to hear from some expert panelists on the response to that, and I'll be introducing those people as we get to them. We want your participation in this town hall today, so you'll have chances to post questions to the panelists. You can start doing that now if you want. There's a Q&A box that you can post questions into, and we will try to get to as many of those as possible after we make some opening remarks here. So with that, why don't we go ahead and get started and hear about the survey results. I'm really glad to be able to introduce Dr. Fred Smoller, who's an associate professor of political science in our Wilkinson College of Arts, Humanities, and Social Sciences. He's also the co-director of our OC annual survey, which you'll hear about today. He'll be presenting with Dr. Mike Moodian, who's a lecturer of leadership studies in the Tala College of Educational Studies. And in addition, he co-directs the OC annual survey that you'll be hearing about today. So with that, I will turn it over to them to present the survey, and then we'll hear from some additional panelists. So Dr. Smoller.
Okay, let's see if I can get this to work. So tell me, can you see my screen?
Yes, we can see it.
Well, thank you, Tom and Dr. Chau, and I appreciate the opportunity to present the data. As you know, the coronavirus has really been a gut punch to our community. More than 250,000 people have been infected with the coronavirus. 5,000 people have tragically died. And there have been major disruptions to our life. Our schools have been closed. We can't go out to eat go to the movies or shop and do the things we're used to doing, even going to the beach. And this has caused tremendous political division. Just about an hour ago, the grand jury issued a report on the county's pandemic response and its plans. Yesterday, the County Board of Supervisors decided to table a motion to have what are called vaccine passports, basically online confirmations that you had been vaccinated in response to 500 people who were complaining about that at their meeting. And today's Los Angeles Times also talks about Orange County and repeats what we believe are some discredited tropes about our very hard right conservative reputation. So it was entirely appropriate that we included pandemic related questions into the annual Orange County annual survey. And I'm going to turn to my co-director, Dr. Mike Moodian, who's going to explain how we conducted the survey. And then I'm going to come back and talk about some of the results. Dr. Moodian.
Wonderful. Thank you so much. And thank you very much for hosting us again. And it's wonderful to be here with Dr. Chau and with our newly elected supervisor, Foley. As Dr. Smoller mentioned, we conduct this study every year. This is the fifth time that we have conducted an annual survey, a county-wide survey of Orange County. Professor Smoller and I conducted our first survey in 2010, and we have conducted 4 consecutive surveys. What we do is we keep a certain percentage of the questions the same from year to year, and then we change roughly 35 to 40% of the questions every year, and we focus them on a different topic. So a few years back, we focused a good number of questions on housing and homelessness. Then we focused a number of questions on transportation the following year. Last year, we conducted a study where we looked at county residents' views toward climate change and toward extreme weather instances. And we found that the county has changed in many ways in terms of its views from a 10-year span. This year, for our study, we focused a good number of questions on the coronavirus and on government's response to handling this pandemic. So here are the details in terms of the methodology. We conducted the study earlier in the year, and we release the results every year. We write a report and release it around this time every year. We had a representative sample of slightly more than 700 county residents. Surveys were conducted in both English and in Spanish, with a margin of error of roughly 4%. These were telephonic surveys. We used a firm based out of Texas to make the calls, and they were done both via landline and through mobile calls. And we're very grateful to our sponsors of the study, Fieldstead and Company, and also Chapman's Office of Research, the same office that puts together this wonderful Ask the Experts town hall every week. So that's the background of the study. We do this study every year. It's not meant to be necessarily a political survey. We're not out there, questioning people based on their registration status. Instead, we're trying to capture a snapshot of county residents' views towards social and political issues. And we do this to spark informed debate, and we do this to help educate the public. So I'll turn it back to you, Professor Smoller.
All right, thank you, Mike. Well, here are some big issues that have come up during the last year. A very vocal group of people have said the whole COVID problem, the COVID virus, is a lie, or at minimum, it's been blown out of proportion. And you can see this. We have some photos that we're going to be showing you. And but when we went and asked in our survey what percentage of the people felt it was real, whether it's a real threat. Excuse me, please. 83%, only 17% said it was exaggerated. Then we go over here. Many people have taken exception. Well, not some people have taken exception to the notion of social distancing. But when we asked people in our survey, what did you think? 90% said social distancing was okay. And very few were suggesting that it's some type of communist plot. We asked people also about the mask mandate. This lady is holding up a sign here saying no masks. And so again, we said, do you support this of our 700 people? And in fact, again, overwhelmingly supporting the national mask mandate. And overall, we were trying to get a sense of, is this effort by the government to curtail the virus going too far? Is this government overreach? And this has been something that's been alleged. Here is someone holding up a protest saying that this is a test run of socialism, and it's simply an inappropriate use of government power. And this would suggest that the government was simply out of line and they were going too far. But our panel, the people we spoke to, said, wow, only about a quarter said the government was going too far, but most people, 73%, that said the government's response was just right or not even far enough. Then Mike's going to pick up on the economic impact of the virus. And if you could get to that.
Certainly. And as Professor Smoller mentioned, we also asked questions around the virus, the pandemic, the restrictions, and the economic impact on families and on individuals in the county. If we could go to the next slide, please. We asked a question on the economic impact and whether that has been severe on individuals or whether it's been moderate or whether there's been no economic impact on individuals in the county. This was an interesting result. 87% of respondents stated that there was a moderate or no economic impact during the pandemic. And just providing a very quick analysis of this, I think back to this Ask the Expert series and a panel from a year ago where Joel Kotkin talked about this idea of this new, he calls this the new feudalism in California. And Kotkin mentioned the fact that we see in the midst of this pandemic, it creates this environment in which those who are, it further lengthens the gap between the haves and the have-nots in California in terms of economic inequality. So looking at this result, I wonder if perhaps this Orange County, which is a relatively wealthier area compared to other counties in California, maybe this demonstrates the fact that, you know, those who are wealthy perhaps, or those who have been able to work from home have been even more productive. And perhaps in those areas, such as the Central Valley and other areas where people don't have the privilege of being able to work from home, we've seen a wider economic gap that has manifested itself. If we can go to the next slide, please. We also asked about the idea of containing the virus or reopening the economy, which is more important to individuals. For this one, we also broke it down by party affiliation as well. If you look at the right-hand side, the majority of county residents, 64 to 36%, believe that containing the virus is more important than reopening the economy. However, you can see that there is a major partisan divide. Those who identified as Democrats or as no party preference believe that containing the virus was more important. That switches those who identified as Republicans in the survey were more in favor of opening the economy versus containing the virus. So Democrats and no party preference voters or individuals tended to sway this to a majority. If we can go to the next slide. The other issue, schools. This, of course, has been a hot button issue, especially in Orange County. You might recall going back to last summer, the Orange County Board of Education, there was a controversial recommendation that was made. Orange County Board of Education actually doesn't oversee any particular school district, but they made this recommendation about kids coming back to school without having to wear masks, and that led to quite a fiery debate upon members of the public. We asked a question about school, and if we go to the next slide, the question specifically that we asked was whether schools should be opened immediately with proper precautions or whether they should remain closed until the threat of the virus has passed. There were a majority of county residents, 56 to 44, who believe that schools should be reopened immediately. So this was a little bit closer, but county residents do favor reopening of schools, provided the proper precautions are taken. And if we can go to the next slide. Also, we asked questions about whether individuals plan to get vaccinated. And of course, this could not be more of a timely discussion to have right now. Yesterday, if you've been following the news, there was quite a turnout at the Orange County Board of Supervisors meeting around this idea of vaccine passports, electronic vaccine passports. If we go to the next slide, I can share with you our results. You know, we find that even though Orange County, places like Huntington Beach and others have really been the center of nationwide news as part of this anti-vax movement, anti-pandemic restriction movement, we find that there is more or less, and Professor Smoller will talk about this in the conclusions, there is this kind of reasonable silent majority, if you will, who plan to get vaccinated. And if you look at Orange County's numbers, according to the LA Times, we are pretty much on pace with the rest of the state in terms of vaccine rates. So even though you have a lot of people making the news who are perhaps opposed to vaccines and so on, it's different in terms of the actual results. So if we can go to the next slide. And we asked questions in terms of those who objected to taking the vaccine, what their main objections were. Top 2 reasons for those who had vaccine hesitancy or objected to take it. Number 1, there's this perception from people that it's not safe. Number 2, it seems as if there's a perception from people that perhaps this may have been rushed and it needs further testing before it can be deemed safe. If we go to the next slide, we also asked a question about the confidence. And if we can go back there, the confidence in terms of who people trust in terms of handling the pandemic. And if we go to the next slide, Professor Smoller, yeah, there we go. The Orange County Healthcare Agency, 74% in terms of those who said a great deal of confidence or some confidence. Also, Dr. Fauci, our national figure, who has been the national kind of that figurehead in terms of providing advice and being the face of the responses. But then we see when we start to get down to government leaders, there is less confidence. So one conclusion that Professor Smoller will discuss is that people have faith and confidence in the medical experts, not as much when it comes to government leaders, both statewide and locally. And if we can go to the next slide, please. And I'm going to turn it over to Professor Smoller to share the conclusions that we were able to draw from this.
The data that we're presenting here today matters. We believe that the vast majority of Orange County is far more moderate than its national and even its statewide reputation as being this hotbed of extreme right-wing activity. Now, there is a small, comparatively small, I would argue fringe group that has been very loud, and ordinarily you might say, gee, we can ignore them, except they do pack the Board of Supervisors meetings, and we saw a major policy change over the passport yesterday when at least 4 of the members of the board voted to table that initiative. And we also see that the national media, including our own LA Times, continues to report about Orange County in ways that we think does not represent who we really are. So these are my conclusions, and we're going to turn it over very quickly to Supervisor Foley and to Dr. Chau. But basically, the COVID deniers, the anti-maskers, the anti-vaxxers do not represent Orange County. There is indeed this silent majority that's been very supportive of government initiatives. They've taken the virus seriously. They believe it's a threat, and they support government efforts such as wearing a mask and social distancing and getting a vaccine, and even to the point of saying we got to get rid of the virus before we can open the economy. There has been moderate economic hardship, and what Dr. Moodian, I think, was pointing out, that it seems to be very bifurcated. In some ways, the people who can work from home have become more productive, but the people who are working, can't work from home and doing physical labor, they've really borne the brunt. So our data are looking at macro indicators of the entire county that it suggests moderate economic hardship. And the good part of that is that we may spring back very, very quickly, which is what economists have said. Interesting, for all the anger that's been directed at Dr. Quick and Dr. Fauci and perhaps Dr. Chau, I'll let him speak for himself, it is the healthcare professionals that have the confidence of people, not the elected officials. Perhaps when people get sick, they say, I go to the doctor and it's doctor's orders. We don't contact our local sheriff or elected official to ask what we should be doing. We listen to the medical professionals. Nevertheless, when you drill down into the data, we found major partisan differences. The Democrats and the people who said they were no party preferences, they tended to be more supportive of the conclusions here. And the Republicans tended not to be very much opposed to the initiatives that included masks and social distancing, etc. The one thing where there seemed to be consensus is this. Everybody thinks, not everybody, excuse me, but a majority believes that we need to get the schools reopened immediately, provided that proper precautions are taken. Well, we've taken up more than our time. That's a snapshot of our data. You can look at the full survey. It's been sent out. But now let's turn it over to the real experts, and that would be Supervisor Foley and Dr. Chau. All right.
Great. Well, thank you so much, Dr. Smoller and Dr. Moodian. Those are some really interesting results and a lot to comment on. And I will just end that it's always good when we have at least one item there that everyone can agree on. And I think it sounds like everyone can agree that people getting back into the schools is something that we can all agree on. So that's always good to hear. With that, as Dr. Moodian or Dr. Smoller said, we invited some panelists to respond to the survey results, panelists from our community leaders. We reached out to the county supervisors, and we were really pleased that Supervisor Foley agreed to participate. Supervisor Foley is a community leader, successful businesswoman, working mom, and attorney who became Orange County's first Democratic supervisor in 2021. Congratulations, Supervisor Foley, and welcome to the panel. I also want to introduce Dr. Clayton Chau. He's the Director and County Health Officer of the Orange County Healthcare Agency. He was previously the Chief Clinical and Strategy Officer for Mind OC. That's a nonprofit entity that supports Be Well OC, a coordinated system to improve Orange County's mental health services. Thank you, Dr. Chau. I know your time is really valuable, and we appreciate you coming on. So with that, I'm going to ask Supervisor Foley maybe to start the discussion and your response to the survey results there.
Well, thank you. You know, the survey, let me just start by saying I was not on the Board of Supervisors when you took the survey. But the survey, I think, pretty much corroborates what I found. I mean, I don't think I'd be sitting in this seat right now if the majority of residents in Orange County didn't believe in vaccinating, if they didn't believe in the science, if they didn't understand that COVID was real, because my entire campaign was all about those issues. I ran on a platform of getting more vaccinations out into the community and taking care of our local businesses because of the impacts of COVID. So I'm glad that, you know, my gut told me what was, but more importantly, the data, I think, supports it. What is also, I think, helpful is, and we sat through this meeting yesterday. Part of why we only hear from a minority viewpoint is because the county, frankly, does not enforce masks, does not enforce social distancing when the people come to speak. And so therefore, a lot of people who have an opposite opinion are not coming down to the county. And we're not providing an opportunity for people to communicate to their local, you know, governing body through Zoom or through some kind of a telephonic manner. As mayor of City of Costa Mesa during the entire pandemic, I think there was one meeting where we did not have a telephone or Zoom capability for the residents and the constituents of the community to participate. And that was just because it was at the very beginning and we didn't know how to do it. And so now there really is no reason why we can't do that. I've asked the board, I've asked the CEO to implement that, and we'll see where it goes. But we do need to hear a balanced view, because the data that you're sharing here today does not reflect the communication that we received yesterday, certainly doesn't reflect all the organized campaign and of opposition that is really just, it is a campaign. It's not reflective of just regular people living their lives. So I'm grateful that you do this work. And I think that it's important that we have data, that we use data to make decisions. I know Dr. Chau, I'm always asking him for the data so that I can make decisions based on science and data and not just based on, you know, what's my opinion. I'm a lawyer, I'm not a doctor, not a scientist. I just think we have to rely on the data. So I'm grateful to those of you who are helping us to be able to learn from that data.
Great, thank you very much, Supervisor Foley. And I want to correct myself too in making my introduction to you. I didn't properly introduce you as Orange County's first woman Democratic supervisor.
Not
so
the first Democrat, yeah, the first woman Democrat.
That's right, and
the first Democrat in District 2 in over 100 years. So, so there's something there. But you know, more importantly, I think I'm able to serve in this capacity, not because I'm a Democrat, but because I am appealing to what are the concerns of the residents, whether you're a Democrat, Republican. You know, I won Huntington Beach, go figure, right? So, so I had to appeal to Republicans and no party preference, those that believe in science, those that are practical in their ideology, common sense. I try to lead, whether I'm the mayor, school board member, or supervisor, I try to rely on the data, understand the concerns of the constituents, and have a practical application so that we can improve the quality of lives for you know, our constituents. So those are always what drives me.
All right. Well, I'm going to now let Dr. Chau, who I introduced a minute ago, and he's certainly been a leader in our healthcare community, maybe respond to the survey results and what you heard from that, or what you saw from that. Dr. Chau.
Thank you so much. Thank you so much, Dr. Moodian and Dr. Smoller, for conducting this important survey. I can't tell you how emotional I am right now, given what has been happening this last few board meeting. To get the survey results that Orange County Healthcare Agency is the most trusted out of all, and your results is really good news for me and my entire team. I can tell you that we've worked tirelessly since the beginning. The work is not what get to us. The work is not hard. Personally, I'm used to this kind of work. The hardest piece is the politicize of the pandemic, and how a small group of folks really have the loudest voice and misrepresent our community. You probably have heard me constantly saying that I don't believe that Orange County is the hub of anti-mask, anti-vax folks in the country, because our numbers, our metrics for COVID are really, really good. As you probably heard, we got 1 week of yellow tier metrics under our belt, and next week, officially, we probably will most likely 99% will enter the yellow tiers. Those numbers don't lie. I did not make up those numbers. Supervisor Foley and the board did not make up those numbers. It is the work of the community, the compliance, if you will, lack of better words, to the science, to the guidance that brought us here now and today. And I'm so grateful for your survey. It really reconfirmed and further affirmed that majority of our residents here in Orange County are trying very hard and believing in true science and believing what is the right thing to do for the community, despite this individual right that people talk about. In the time of the pandemic, yes, that's the beauty of our country, is that we respect individual right, but you gotta think of a community, because we don't live alone. We are a social human animal where we need to pay attention to the well-being of the entire community, of your neighbors. And so this is great. This is so timely. And that's why I'm saying that I'm just too emotional at this time to say anything. So I'm grateful for this conversation. I'm grateful for the work that you've done. And I'm grateful to the entire community for what people have sacrificed to do the right thing for the well-being of the entire community.
Dr. Chau, can you share with us I hope it's okay. I tend
Yes, certainly.
to. Dr. Chau, can you share with us how many Orange County residents in total, regardless of through what application, have been vaccinated now,
Yes.
at least one shot?
Yes, thank you, ma'am. And I know the LA Times has given us some data in their article, but I think those are incorrect. So this is as of a week ago, and I'll tell you because the data system in the state, there's a lag in reporting and there's some inaccuracies in that. But as of a week ago, Orange County has over 2,752,000 shot in arm.
So that's really important. There's 3.2 million residents here in Orange County. Now, a good number of those residents are children under 16. Until yesterday, we're not allowed to be vaccinated. We're not eligible for vaccination. So out of 3.2 million, we already have, what is it again? Repeat it.
2.7 million.
2.7 million. So we own, we have a small number of residents left to be vaccinated. I think those numbers alone reveal the overwhelming support in Orange County for vaccinations. Overwhelming, super majority.
Yeah. Right. So it translated to about 67% of individuals who eligible for the vaccine have gotten at least one dose, 67%. And remember, President Biden wants us to achieve 70% at least one dose by July 4th, right? We are very, very close. In Orange County, a week ago, we have 1.15 million people who are fully vaccinated. That translated to 48% of our population have been vaccinated.
I'm one of those.
This is fantastic. This is fantastic. And the most important things, and I'm so proud of my team, and I'm so proud of the vaccine task force. By the way, Dr. Goetz from Chapman is part of the vaccine task force. And I'm so proud of our supervisor for supporting. Early on, if you remember, Orange County was the first county that moved ahead and vaccinate seniors 65 and older. We started that before the state even started that. And so that now gave us at least 83% of our seniors over the age of 65 have seen one shot in arm. That is incredible. And that's why you've seen a dramatic drop in the number of people who are hospitalized or in the ICU, as well as death. We've not had a death since April 22nd. We've not had a death since that.
And I think important.
The hospital number now is about 83 in the hospital, and out of the 83, 18 are in ICU. That's the lowest we've ever seen. So
I want to commend Supervisor Foley and Dr. Chau for those. Those are excellent numbers for Orange County, and I'm really thank you for sharing those. I think it represents kind of what the community is doing, the impact that it's having also. So I think we're getting a lot of questions already, and I may just jump right in because I think really
Let's take the questions.
People want to hear those questions from you, and I think you all have a lot to say. And we also want to respond to the survey that Dr. Smoller and Dr. Moodian presented there too. I'm just going to jump right in because this was the topic you brought it up, and I think people want to hear more about this. There's a high level of support for vaccination. I think people are appreciative of Supervisor Foley coming out and supporting the idea around an electronic record. So people, as a lot of us are going to start thinking about going places, whether it's traveling or having to go to places where we need to show proof of vaccination. How do we go about doing that as we move into a different phase now where we're going to have to be able to, there may be businesses having to show this, or if we want to travel, we have to show this. What do you say to residents that want to be able to do this in a convenient way? We understand there are certain sensitive issues around this also. What do you say to them that really want to be able to do this in a convenient way and want to be able to have that QR code to be able to show them to be able to do this? And Maybe
Can
you'll
I-
start with Supervisor Foley and Dr. Chau also.
Thank you. So I want to clarify something first, because part of what I think Dr. Chau and I and others have an obligation to do is set the record straight. The misinformation campaign is very damaging to our public health efforts. So one, this was always a voluntary opt-in program. Two, it was never, ever intended to be a mandate by the county to any like markets and food, grocery stores or anything like that as a requirement for people to enter to buy food. That's false, that it was never even discussed for that. Three, the main purpose of having this convenient application is that we're a digital world. You know, universities, Cal States, community colleges, they're all requiring proof of vaccination as we enter into in-person schooling in the fall. I have two young men who are my sons that are in college, and we've been discussing this. And their world is all on a cell phone, okay? They don't carry around a card with them anywhere. Their world is on a cell phone. So this is a convenient way for us to get proof of vaccination where needed. For businesses like sporting events, venues, concerts, the performing arts theaters, all kinds of places where you're used to having a lot of crowds and people packing in, they are still required to maintain social distancing and masks unless that business can require proof of vaccination. So this tool would allow a consumer like myself or you to be able to attend a vaccine zone, if you will, at a baseball game. Everybody there is vaccinated. There's proof of vaccination, so you can all participate without your mask, without social distancing. You could get more people into the venue. They could have maximum capacity. So that's what this was intended for. And then finally, for travel. I mean, we're not living in a bubble here. We are part of a whole system, an international system. There are countries that are requiring proof of vaccination to travel to those countries. We have international business people that travel. We have families that travel back and forth who have international families and need to be able to get back and forth and be able to prove they're vaccinated through an electronic system. So we are not in a bubble. We are part of a greater ecosystem and a greater technological system. And so we were just trying to give a convenient option. This was never a mandate. It's not a tracking device. If you don't want to be tracked, then get off of your cell phone, okay? That's what I have to say about it. Okay, Dr. Chau, now you can
Dr.
talk from
Chau.
the medical side.
So from a healthcare entity perspective, we are obligated by law to produce a proof that we provide a service for our patient, including vaccination. Now, for those of you who've been vaccinated, you remember that you got a white CDC immunization card that anywhere you went for the vaccine, COVID vaccine, you were given a card. But if you remember recently, both the CDC and the FBI warned that those cards, there has been rampant business in selling fake cards all over the internet. There's recently someone who was caught for selling those cards, a pharmacist in Southern California, for selling that card. Okay, and so we know it's fraud. So the business side understand that if, oh, let me back up. Then the state guidance for business now currently said, and even beyond the blueprint after June 15, is that the state would allow businesses to increase the capacity only if they're only admitting people who have proof that they've been fully vaccinated or they tested negative. That is in the state blueprint. This was issued by the governor's office on April 6th. You can go on to californiagov.com and look at the Beyond the Blueprint. The title of that announcement was Beyond the Blueprint for a Safer Economy. April 6th. On the bottom, when it said transition from the blueprint, it clearly said allowing increased capacity or numbers of persons allowed, including indoors with proof of testing or vaccination. So we created this QR code as a way for folks who've been, and over millions of people who've been vaccinated through the county healthcare agency, should they want proof that for any reason, any purposes, that we have a way to quickly give them the proof. That's all there is to it. There have been accusations that I'm creating a passport, that I'm allowing for business to discriminate, that I will mandate a non-approved vaccine because all the vaccine we have currently are authorized, that I was secretly vaccinating children without parental consent, without parents' knowledge. I didn't realize that I have that much power. Really false accusation that had been spread rampant. So it saddened me because I don't think that the individual who have not gotten the vaccine, probably because of barriers, because of light confusion, not hesitancy now, light confusion, and all this accusations and false information that been spread out there caused them to be a bit hesitant in accepting the vaccine.
Dr. Chau, will you please share with the panelists as well as the public about how Orange County actually has greater protections for children who are under 16 or under 18 for getting the vaccine?
Yes, so that's one thing that I'm very strict, and I go against the state guide recommendation, and that is for any minor in Orange County who wish to have the vaccine, their parents or their legal guardians must show up with them on site to sign the consent. I do not allow a letter because we all been there. We know how we can get letters, and I do not allow parents to use a phone and call. The parents, the guardian have to show up in person. And I know it creates inconvenience for many parents, but I apologize because I feel strongly that any medical procedure given to a minor must involve an adult because that is too much of a burden on the child or minor, him or herself. So it is required in Orange County that the parents and the legal guardian have to show up.
Dr. Chau, or Dr. Sorry. Dr. Chau, I want to follow up on this because I think as we move into this new category of children between 12 and 15, I think if you look at the national numbers on this in terms of parents that are confident in giving their children the vaccine, it's fairly low. I think I saw it at like 30%, I think. It may be different in Orange County. What would you say to parents of children that are a little bit, and I think a lot of this is just healthy concerns that they might have about children in that age group and not quite sure about whether they should be getting their children vaccinated? What should they be thinking about? What they should be doing? You know?
Yeah. So the American Academy of Pediatricians Orange County chapters are planning for mass educations of all the pediatricians as well as the parents. We're working with the Boys and Girl Clubs, all 14 chapters in Orange County. We're working with the Orange County Department of Education to provide education for the parents. I would encourage the parents to get the fact. Don't listen to rumors. Don't listen to wrong information. You can get the fact by getting onto the CDC website, the California Department of Public Health website, to the county website, or talk to your pediatricians. That should be the person you trust the most. Now, I understand that there are pediatricians in Orange County who against vaccine, but I think those numbers are very small. And if you have a pediatrician who gave you that opinion, get the fact. I mean, you really, the facts is out there from reliable sources. Again, the Center for Disease Control and Prevention, California Department of Public Health, and Orange County Health Info.
You know, one of the facts that I think is really important as it relates to this issue, and we heard this yesterday, is that there's this perception that there wasn't enough trials, there wasn't enough studies of this vaccine, and therefore it's not tested. Now, that is just not true, but we're not doing a good job as I think government agencies of pushing out the facts and pushing out what is exactly what are the trials that have been done. I mean, there's been tens of thousands of test subjects, if you will, trials done on this vaccine, probably more, and I'll let Dr. Chau speak to this, but more in a condensed period of time than we've ever seen, because it's a worldwide pandemic. So there's lots of test subjects. It's like millions of people infected, right? So, so that I think is a misnomer that is being the part of the misinformation campaign.
So I want to give Dr. Chau and Supervisor Foley a short break here, and maybe shift our focus a little bit back to the survey, and maybe ask Dr. Smoller and Dr. Moodian a question. I think some of the questions I'm getting from the audience, and it might be on, are there limitations on the survey in terms of audiences that we might be getting responses from, whether those are non-English speakers or potentially one question came in around Trump voters that may be less likely to participate in phone surveys like this. Is there a certain bias in these types of surveys that comes across that's not captured? You know?
Yeah, I'll speak to that. Can you hear me?
Yep.
Okay, great. Surely the public has grown skeptical of the survey industry after the 2016 tobacco, and then again in 2020. Nevertheless, public opinion surveys done well can be a tremendously reliable source of information. Now, we take that into consideration. I saw one of the questions. We use statistical techniques, random digit dialing. We have our languages in English and Spanish. There's always a chance that the information could be inaccurate, but we found such large percentages, it wasn't even close, on some of these questions, overwhelming in one direction or another, that I really would bet if we were to duplicate it today in a similar manner, that we get the same results. And it's important that we didn't have this collected by college students or friends of Fred or Mike or a particular political party. This was data, these questions were taken from other surveys, which is legitimate in this business in some cases, and modified for Orange County. And more importantly, the data were collected through an organization, a business market research firm in Texas. We're very confident. We can discuss the methodology, but we're confident that they are reflective of Orange County.
Maybe just to follow on that, and then Mike also, if you want to respond to this too. The survey was done in March. Yes. And as we all know, this is a topic that every day it seems we get new news on it. Do you think the results would change if you ran it again today?
Mike, you want to comment on that?
It's hard to say, you know, but just going back to the comment that Fred made, in plain English, more or less, what we also do is we do a series of qualifiers to make sure that we have a representative sample to the largest extent possible. And then also there was a question in the Q&A component where an attendee brought up a notion that perhaps those who are Republican might be less likely to participate in a phone survey. I know that there was a very, very highly regarded Obama pollster who made a public statement in an interview that I saw in the last month or two, where he said that during COVID, polling results are skewed because his quote was that Democrats were staying home and taking it seriously, so they'd be more likely to answer the phone, while others might be not taking it seriously. I think that was too broad of a statement to make as it relates to polling, because that's why we have qualifiers, and that's why we have, you know, a very specific protocol of achieving a representative sample, where if we're finding our numbers are skewing too far one way or another, we make sure that we only collect respondents that tend to be representative of the demographics of the county. And regarding the question, that's a good point. This has been evolving dramatically one week to the next. So sure, it is possible that the results could be a little bit different. It's hard to tell. Just don't know. But in terms of vaccine hesitancy versus willingness to take the vaccine, we find that our results have been consistent with what we're seeing in the county in terms of vaccine numbers of what people have actually gone and done.
Let me,
thank you. Or can I move on to the next question, Fred, real quick?
Okay,
I want to make sure I get in as many as possible here. I want to ask Dr. Chau and Supervisor Foley a question. You know, June 15th has been designated as a really important date. I think a lot of businesses are looking toward this. The state has designated it as a date where the state is going to be opening up. What does that look like in Orange County in terms of whether it's businesses that are operating, people that are, you know, in their daily lives, whether they're going back to work or going out, you know, how are things going to change on June 15th, or do we know yet? You know, Dr. Chau, you want to start?
Sure. I think when Governor Newsom spoke about June 15, we were very hopeful, but because at that time, the vaccine availability were low and the demand was high. Unfortunately, this last few weeks, the demand for the vaccine has dropped significantly, and you've seen it throughout the state, throughout the country. And so I think that Governor Newsom and his team would probably have to be really careful in crafting the message of what June 15 would look like for us. I don't think we get to the point where we'll go back to the pre-pandemic, because even as the announcement that I just referenced to on April 6th, the Beyond the Blueprint for a Safer Economy speaks to some restrictions, i.e. proof of vaccine or proof of testing. So in general, I don't think the mask order will go away, although you probably heard over the weekend, Dr. Fauci have discussed in changing the mask order. You are now know for outdoor activity, folks who are fully vaccinated have much more leeway than folks who not. And there's talk of changing the requirement for masks indoor for people who are fully vaccinated. Now, the CDC spoke to that as a strategy, an incentive to encourage people to get vaccinated, but I'm afraid that it creates more confusions and the ability for employers to really be in compliance when you have a mixture of folks who are vaccinated versus who are not vaccinated at the workplace. So that's my fear. But definitely for Orange County, as you've heard me said earlier, we're moving into the yellow tier next week. We'll continue to do well, I hope, because I strongly believe that Orange County residents have been doing the right thing and will continue to do the right thing. There will be talk about the mask mandate post the pandemic, perhaps seasonal, because we've known that because of the mask mandate, the number of people who were hospitalized over this winter due to the seasonal flu vaccine, also for the flu season, for the flu virus, has dropped dramatically as well. So we do know that the mask does protect people from infectious disease transmission. So we probably will see a seasonal requirement of the mask.
Great. Supervisor Foley, you want to comment?
Yeah, you know, I think that June 15th, May 15th, July 4th, I don't really know if it matters because really most businesses are open. Most restaurants are open. I know throughout the pandemic, even in the height of the spread of the infection, I had been very concerned that there was no enforcement of any of these things, and we're just basically going by the honor policy. And so I think that's really what we're doing now as well. And so my goal is just to get as many shots in arms as we possibly can so that we will be able to, you know, celebrate and not have to worry about whether or not we should have 50% dining indoors or 200 people. Nobody's going to enforce any of that. So I know I'm probably not supposed to say that, but that's just the reality, and I deal in reality, not in just what's on paper. So the truth of the matter is that we are all getting back to normal. I know my family, my son celebrated his birthday last week with us. We finally, with the grandparents, got to go out to dinner, all of us at the same time in an outdoor, venue for dinner at a restaurant. It's the first time we've done that in a year. And so many families are looking forward to that. And I'm excited about it. I didn't wear my mask when I took my 94-year-old grandmother down to the beach to celebrate Mother's Day this weekend because, Dr. Fauci says if you're all vaccinated, it's okay to be outside without your mask. And so I'll do my best to avoid crowds. I'm not going to go indoors to a crowded place. My entire team here at the county is vaccinated, and we still wear our masks inside. So we just all believe that we want to stay well and healthy. And I think most people will follow that kind of advice. I did want to address something about, and maybe Dr. Chau can address this, because this goes to how some of the misinformation campaign is harming our ability not only to protect the public health now, but into the future. So the long haul COVID is becoming part of the scientific discussion right now in the scientific community, and how if people already had COVID, this concept that, oh, I had COVID, I have antibodies, I don't need to get vaccinated. That's not scientifically accurate. So maybe Dr. Chau, you can address that, because I am concerned about long haul cases. I'm concerned about people understanding what the antibodies can do to protect you if you're not vaccinated. And I'm hoping that we can start to spread the word, because the survey that you did, getting it back to the survey, shows that the majority of Orange County residents believe in science. So we want to get the science information, the accurate information out there to them so that they can make good decisions. Dr. Chau.
So maybe Dr. Chau, before you respond, because we're coming up on 2 minutes here. So maybe if you could respond to that very specific question, because it is an important question. I've had that actually when I've been out and with friends around the question of, if you've had COVID, do you really need to get a vaccine? But maybe just a parting word, because I'm going to do a lightning round here real quick. Your parting words in terms of what should people be encouraged about in terms of as we move into the summer and the fall here and people going back to school. So maybe 30 seconds, Dr. Chau, as we wrap up here. Yeah.
Yes, the answer to that question that Supervisor Foley posed to me is actually my ending statement, and that is, we all need to get vaccinated, because the natural immunity from the infection won't protect you. And you heard me talk about this before, and I will still stand by my words, and that is, we have no way out of this pandemic without the vaccine.
Great, thank you. I'm going to turn to Fred and Mike now, and maybe let Mike go first. People have asked, are more of these types of surveys going to be done? Asking some of the why, some of these responses. So what are your plans for doing future surveys like this? Mike, I'll start with you. Yeah.
Sure, we sure hope so, and it's something that I think has been very, very rewarding, and we do this in conjunction with our public policy conference every spring. So certainly hope that that we can. And Professor Smoller,
making public policy without access to reliable survey data is like flying a plane without radar. You're going to be responding to the loudest voices in the room, and that's not the way a county of 3.1 million people should be making public policy. We're doing one of the countywide surveys. The criticisms that have been made are valid. A survey is always limited. It's a snapshot of a moving train. And I do believe that if we want to have confidence, that we should be doing more of this. And when the board members look at their, $8-9 billion budget, they should ask how much of that budget is directed to collecting data upon which we can make solid debate and decision.
Supervisor Foley, I just commit to us supporting this effort next year. So you know, ma'am.
Thank you, Dr. Chau. We appreciate that. And Dr. or Supervisor Foley, I'm going to give you the last word and the last question. Some of the participants have asked, you know, some people are not able to attend meetings, or what's the best way for them to get feedback to supervisors if they're not able to attend some of these meetings and they want to be able to give valuable feedback both to you or other supervisors?
Feedback is really important, and I read all the communications. And so attend city council meetings, attend county government meetings, attend commission meetings, get your voice out there, whether it's in person or by Zoom call where available, send emails. But I would say also, you know, you could write letters to the editor. You can, you know, send letters to your friends, text messages, post your information that you care about on your Facebook page. Don't be afraid to speak up. I think that what we've seen over the last couple of years is that people have recoiled because they don't want to be in conflict with their friends, because this pandemic and what we've all been through over the last 4 years have really caused people to feel like they don't want to be in conflict with people who have differing views than they. But you can still express yourself by sharing accurate scientific information. Go to the health advisors that you trust and share that information. But as far as communicating with your local government, you know, make a phone call, set up a meeting. Every office does Zoom calls with many constituent members. Join a town hall. We have roundtable discussions in our office, you know, almost weekly. So get involved. We need your voice.
Great, and that's a great way to wrap up, Supervisor Foley. Thank you to everyone, Dr. Chau, Dr. Moodian, Dr. Smoller. Thanks also to Amy Stevens, Adam Winton, Terrence Troop, who worked in the back end to support this event. Thank you all for participating with your active questions. We really do appreciate it. I apologize if we weren't able to get to them all, but we will have future events. And with that, thank you all again for participating, and have a great day.
Bye-bye. Get vaccinated.
Thank you.